Hello, it's Dr. Rhonda Johnson. Today's Saturday, December 4th, 2021. And today my message is called Smoke and Fire. The Omicron variant is what a Harvard epidemiologist has called astonishing to behold. This variant has over 50 mutations. It's been sequenced in COVID infections in more than 10 states from New York to Hawaii and over 24 countries as of today. There's still not a lot of conclusive scientific information about Omicron. And when it comes to COVID, what works in the lab and what is known in the lab doesn't always hold up in real life. You have to see how this variant will play out in people and in communities. Again, at this moment in time, scientists don't know if Omicron is more transmissible, that means how fast it will spread, or if it has immunescape properties, that means the ability to prevent detection and killing of this variant by our antibodies or immune cells, or if it causes more severe disease. What the experts do know that is in South Africa, this variant has been attributed to a rapid rise in infections and hospitalizations, primarily in children and young adults. So Omicron has the capacity to be quite serious, but it's going to take a few weeks and months to know what it will do. That's why I'm calling Omicron the smoke. But now I'm switching over to the fire. We are in the death grips of the Delta variant. Yes, Delta has caused more deaths in the United States and the world in 2021 than the original virus strain in 2020. It's the Delta variant that sits as the king and the queen right now of the COVID variant hierarchy. And it's Delta that's causing the fire that is raging around the world in terms of COVID deaths and disease. Here in this country, emergency rooms are full of sick patients. Some hospitals have no ICU beds. Some hospitals have had to cancel elective surgery. Patients who are sick and dying are overwhelmingly unvaccinated, according to the CDC. And folks, these are just the facts. Now, I'm a parent, and one of the first things we do is teach our children not to play with fire. We do things that help reduce the risk of fatal fires. We have smoke detectors in our homes and in our buildings. Some have fire extinguishers, and some homes and buildings even have elaborate sprinkler systems. The Delta variant is the COVID fire that is burning badly and is out of control. Yet people continue to play with this fire, assuming they won't get burnt. But there is a Delta fire prevention strategy. It's called the COVID vaccine. It won't keep you from getting infected. Or using this fire analogy, it can't prevent the fire from starting, but the COVID vaccines greatly reduce the risk that your house, which is your body, will burn to the ground and end up putting you like ashes in the ground. You know, we haven't had a forest fire that has killed over 2,000 people in a single day. Yet people are getting burned and people are dying in this Delta variant COVID fire. On December 3rd, which was yesterday, there were 141,000 new cases of COVID and 3,800 people died, according to the Johns Hopkins data tracker. So I'll repeat, deaths in the Delta COVID fire yesterday were 3,800. Folks, it's time to stop playing with this fire. Too many people believe that they won't get burned, but the numbers are telling a different story. Delta variant fire prevention is getting the COVID vaccine and the COVID vaccine booster, period. Let's stop feeding this fire. Let's put out this fire, folks. Text your zip code to 438-829, and you will get at least 2 locations where you can get vaccinated if you need the booster or if you need the primary vaccine series if you're unvaccinated. We still have 2 weeks before the holidays. Get your vaccinations, please. That's my message today. This is Dr. Rhonda Johnson. My views are always my own. Stay safe and have a blessed day.